However, I feel like this one is actually missed really often, and I have seen it a couple times. It's not, I wouldn't say it's super common, but you will, I do believe that if you see ACLs frequently, you will see this from time to time. In this video, I'm going to be talking about a compensation that you might see when someone is squatting. I've talked about the hip shift, which is very commonly seen. Sometimes even a knee diving into valgus. One of the knees might dive into valgus that you might really see. However, I feel like this one is actually missed really often, and I have seen it a couple times. It's not, I wouldn't say it's super common, but you will, I do believe that if you see ACLs frequently, you will see this from time to time. Depending on the athletes that you see. So this is more of a hip compensation, and basically, in a sense, it's a movement pattern that takes pressure off the quads, which is actually very common. That's what our mind wants to do, especially coming off a big surgery like an ACL. So I'm going to show this to you from the side just because it's much easier to see from the side. You're not going to be able to see it from the front. So ideally, when you're squatting, you should be bending your knees, and just for your sake, you guys are aware, I had surgery, another surgery, a cleanup surgery about a week ago, so I'm not going to go super deep. But when you squat, you should be sitting, coming back up, right? Knees, your quads are doing the primary movers of driving up. Obviously, glutes are involved as well, but here is your primary, okay? And for the compensation that I am talking about is typically they'll sit their hips back instead of their knees doing the moving, coming up. So if I were to show you like this, they'll go like this. On the way up, what they'll do is kind of sit their butt backwards first, like this, and then they'll finish the movement. And if you guys even try this yourself, you're gonna feel less quads because you're sitting your hips back. So again, like this, it's subtle, but they'll do a lift like that, okay? So what I typically will do is, I will say that you will see this even more commonly when you're doing on a heel elevated, just because again, that's going to place more demands on the quads. So obviously if they're doing it more so on a heel elevated, you want to regress back down to either less weight or cueing them to make sure that they're driving from their quads and driving from their knees as opposed to sitting their hips back. Maybe film them and show it to them so they can see, oh wow, like I didn't even know I was doing that, which to be honest, most of the time they don't even know that they're doing that. So it's just a simple cue, and I always talk about trying to focus on external cues. This is one of those that's a little bit harder. Just sometimes it's important to create a little bit self-awareness. So telling them, hey, like I don't want you sitting your butt back. I want to make sure that you're driving upwards towards your knees is super important. Sometimes maybe even regressing all the way back down to body weight or much lighter weight, having them turn their head to see in front of a mirror. Not ideal to turn your head, but sometimes just doing that for a couple reps so they get a feel for it, and then they can start looking straight ahead. So again, you don't want to see this. You don't want to see hips back. Okay, you want to make sure that they're driving straight upwards from their quads and their knees as opposed to sitting back from their hips. Okay, so again, just a compensation that I've started to see and I've seen before in the past, but I wanted to make this video just so you guys can see. I do hope to film it as a case study so you guys can see it on a live patient of mine. But at least for now, once you guys become aware of that, so hopefully you find this video helppful.
Thank you for watching today's video. Please feel free to like and subscribe. I have started an ACL Mastermind group, which is a program designed for physical therapists, physios, strength coaches, students, and athletic trainers who want to learn more about ACL Rehab. It currently holds over 600 videos and has over 500 members with new videos added every single month. The videos cover immediate post-op to late-stage sports-specific movements and everything in between. Content specifically also includes rehab complications, treatment philosophies, case studies where you can see my real-life patients, movement assessments, exercise breakdowns so you understand how to properly teach the exercises. The exercises are also arranged by difficulty level for strengthening exercises, plyometrics, balance, and neuromuscular control. Of course, it also covers late stage for movement exercises from structured all the way to randomized and chaotic to mimic more sports-related settings. And lastly, you also learn how to do return to sport testing, which is extremely important. And this what ultimately determines whether or not someone is safe or not safe to return to sports again. There's also questions within the group where you can learn how I engage with patients and their parents of how to answer difficult questions throughout the rehab process, which is inevitable to come up. And lastly, you gain access to a private forum where you can ask questions directly to me and others within the community. We share research articles, we share other equipment and beneficial equipment and things like that. Anything that can come up within the ACL Rehab spectrum, that's where you can ask within the private forum. And lastly, you can also download the app where you can gain access in your respective facilities directly on your phones. If you have any interest, please feel free to click the link below, and I appreciate you watching today's video.